The doctor is in, and today it's geriatrician Dr. Chandini Sharma, and today we're talking about lower back pain and how to handle it. Dr. Sharma, thanks as always for being here.
It is a pleasure. Happy New Year to you.
Thank you. You too. It's good to see you. So everybody can have lower back pain or back pain if you're young, if you're older. Is that true?
Absolutely true. And actually, the incidence or the chance of getting back pain incrementally goes on up and up and up from teenage. Like we've heard growing pains, right? That could involve any part of the body but back pain. And from then on, it just keeps increasing. We were talking earlier and you said sometimes you get back pain when you do too much of the lifting. And especially as you said in your own words, that if the form is off even this much, then you'll feel the back pain. So that would be, so the causes of back pain in younger people are different than causes of back pain in the seniors. The kind of back pain you have is related to bone and muscle because something was just not right. So you tore a few fibrils of muscle. In the seniors also, you can have back pain because of muscle and joint issues or non-muscle and joint issues. Muscle and joint issues, actually, 3/4 of seniors above the age of 65 have some sort of back pain, either now or during the course of their seniorness. And so that would then become chronic back pain that you kind of live with. Sometimes it's tolerable and sometimes it is intolerable. When it is intolerable, then that becomes acute on chronic, something that's making the prevalent back pain worse. Okay. So like, that's the tolerability issue then. So you've got arthritis. That is the most common reason. That is the most common reason why people go to the physician and say, I've got back pain. But if in the first instance when you go for a back pain, most back pain is, when it starts out, self-limiting. It will happen. You do physical therapy, take some ibuprofen with food or Tylenol, rest, ice, do that rice principle. Within a month, it should go away or definitely become way tolerable. If it doesn't, and it's still hurting you quite a bit badly, and about a month has elapsed, that's the time to say, I need more evaluation of this back pain. Even if you've got chronic back pain, and now that acute incident has happened and the pain is now much worse, time to evaluate. In the seniors, another very common reason is that the vertebral bones collapse, nerves get pinched, muscles get torn, discs slide out, the SI joint, like our weight is coming from the vertebral column and then going to the legs. Those SI joints are very integral in dividing the weight to the two legs. If you have leg difference, etc., many causes. The SI joints start hurting. And all these have a certain type of pain that when you go to the provider and say, this is good, this is happening, it'll be diagnosable. So after a month, if the pain is still bothering you a lot, get it evaluated. Treatment-wise, you can never overestimate physical therapy. And you've heard me say this, everything is physical therapy, because it is. Even if you do other pain management, Tylenol, ibuprofen, any other kinds of gabapentin, nerve pain medicine, or other pain medicine, physical therapy is a must.
Awesome. Well, thank you, Dr. Sharma. I appreciate you being here and all of that insight you've given us on back pain.
Thank you.